Have you ever wondered why your shoulder rehab didn't work the way that you'd hoped? Today I'm going to give you 5 reasons why that might have happened, but rather than this becoming a negative conversation, let's turn it into a positive, because those same reasons can be flipped into factors that you can control, and in doing that, you can better orchestrate the outcome that you actually want. I'm Stevenson from Dynamic Shoulders, where we rebuild injured shoulders so that active and athletic people can train and compete pain-free and with confidence. Let's get into it for today. Now, first up, one of the reasons why people's rehab doesn't work out in the way that they want, and this one sometimes hits hard, is because you weren't strong enough. Or if we package that slightly differently, you didn't get strong enough. We'll often use the phrase strength is armor, and that's because robustness is ultimately created by developing greater levels of control, coordination, strength, power, speed, and physical literacy. And the reason that injuries occur is a complex subject because the cause is often multifaceted. However, one key factor that is often present is a lack of strength to be able to manage the demands that are being placed on the body. That has typically had some role to play. I used to work in an elite swimming program, and from a coaching perspective, the major focus of the strength and conditioning setup was just to mitigate the risk of injury. That was priority number one. We needed to keep the athletes in the water. Second to that, the job was to enhance performance through greater physical preparation. So just run that back. If you get stronger, we reduce the risk of injury. So the flip side of that coin, therefore, is that being stronger to try and avoid getting injured means that we are therefore needing to get stronger in order to get uninjured. You can link that together. But now strength training comes in many forms, and when it's done correctly, it is a huge asset in you being able to successfully navigate a sustained return to training or sport. It gets you off the knife edge and back into a place where you are more resilient. Yes, there is always a question to ask maybe about how strong is strong enough. But in my experience, most standard rehab programs are a million miles away from needing to worry about making people too strong. Let's go on to number 2, a lack of adherence. Now, there is no doubt that physical training as a tool for rehabilitation works. Exercise is one of the most evidence-based interventions that we have for musculoskeletal pain. That is, however, only relevant if the physical training is actually done. And that is where the problem lies. The evidence across multiple studies in this area is clear. Reported non-adherence rates in physical therapy are high, and maybe anywhere between 30 to 70%. So whilst we know that physical therapy works and that higher adherence rates are strongly linked with pain reduction and improved function, people still don't do the rehab. Now, I've got some personal opinions on this, but I'll blend them together with what the literature suggests. And for today, let's look at a couple of points. The first is that people might get pain when doing the exercises that they've been given. No one wants to do exercises that hurt, so it's a quick reason to stop. But pain is not always something that we have to avoid because it can be part of a process. What is important here, however, is that people can discern what is acceptable, what isn't, and that they know what to do in order to navigate it so that they can continue to move forwards. Now, personally, I'm in favor of providing a human point of contact. Someone that you can have a conversation with, you can allay your fears, and you can be guided on what to do, therefore reducing anxiety, keeping the train on the tracks, and more importantly, keeping that trend line going upwards. That is arguably going to be a lot more effective than a pamphlet given to you at reception. We can also change exercises, look at technique, adjust load, increase rest, distribute volume across the week better, talk about sleep, stress, all the other stuff that's going on in the human experience. And I recently had a client who had a long-term shoulder problem who played out in this exact scenario. He'd been to all the hospital departments and no one was able to help him move forwards. And one of the things that stood out was that every exercise he'd been given as part of his rehab plan was causing pain, and that pain wasn't changing. Now, the solution here wasn't actually that complicated. We just spent some time looking at positions and patterns that target the same function but didn't cause pain. And all that is required to do that is a better understanding of exercise regression, progression, and a good toolbox of options. I still have no idea why rehab is prescribed when in all other arenas we know that coaching is a superior approach. So my recommendation, therefore, is to look for a rehab approach that integrates a coaching relationship. And the second thing we're going to look at around adherence is low confidence. If you don't believe that the program will work, then you are less likely to do the program. So if it looks generic, if it's been hurriedly scribbled down on a piece of paper, or there's no connection between what you've been asked to do and the outcome that you ultimately want, then people are more likely just to bin it off entirely. We need to remember that people don't go to rehab because they like rehab. They do rehab because they have to, and the main objective is to not have to do it anymore. So why don't we flip the script on this one? What if rehab looked a bit more like training? Maybe we could package it up in a way which felt like a training program but included the rehab. Maybe people would be more likely to do the rehab exercises if they were packaged up in a better way. Exercise selection, presentation, structure, delivery, format of the program, that's all likely to improve adherence because it is probably going to improve confidence. So the outcome here is to find someone who can write a proper training program and that they can deliver it to you in a way which is fitting with the 21st century. We are literally about to be overtaken by robots, and we still have got physios writing exercises on jotter paper and drawing stickmen. That needs to change. Final one, static programs without progressive overload. Another reason why rehab programs don't get the outcome that you're looking for is because they lack progression. If we just give someone 3 exercises and tell them to do them for 3 weeks in a row, same thing, it's a pretty good way to lose attention. For active and athletic people, their shoulder pain soon pales in insignificance compared to this type of training, which is painfully boring. If we were to take a strength and conditioning approach, what we'd see is the acute variables, reps, set, tempos, rest periods, intensity. Those things would change week on week in order to stimulate a desired adaptation. It makes no sense to do the same exercises with the same load and the same repetitions, the same intensity, and expect to get stronger. Without progressive overload, you're basically just maintaining the same level of weakness that got you injured in the first place. There needs to be some kind of change within the program to create a fresh level of challenge, both physically and mentally. People want to feel like they are getting stronger, and if they feel that, their motivation to continue increases, and as they get stronger, pain is going to decrease, function is going to increase, and that further encourages adherence. We are therefore creating a positive feedback loop. The solution here then is to work with different specialists for different phases of training or rehabilitation. Physio for the acute phase, reconditioning or strength and conditioning coach for the return to play. You're getting experts at what they do in both of those areas and therefore magnifying the outcome. So if your past rehab didn't work, it's not entirely your fault, although you might need to take some responsibility because you still have to do the work. And if you didn't do the work, you can't just point your finger at somebody else. However, it might be that you unwittingly plugged into a rehab system and approach that didn't set you up for success, and that is something that you can change. It's time to become more diligent in how you select who delivers your rehab program. The industry is well aware of the reasons that patients don't get better outcomes. What it is struggling to do is to break away from the way that rehab has always been done. Fortunately, a shift is occurring and better options now exist. So if you are an active and athletic person who wants more, seek out someone who can give it to you. If you found this useful, please hit the like button, subscribe to the channel, and share this video with somebody who's stuck in a rehab cycle or who wants to get better outcomes from their rehab. Thanks for tuning in.